need to do better.
Resuming debate, the honourable member for Vancouver Kingsway.
Thank you, Mr. Chair. Mr. Chair, the number of Canadian lives lost to the opioid crisis is staggering, sobering, and growing. This crisis is affecting every community and every demographic across Canada. Over 10,000 Canadians have died from overdoses in the last 3 years alone, and the death toll shows little sign of abating. Last year alone, nearly 4,000 Canadians lost their lives, more than from motor vehicle accidents and homicides combined. The origins of this crisis can be traced back to the late 1990s, when the number of opioid prescriptions began to increase dramatically in Canada. Experts allege that drug manufacturers promoted this proliferation through a deliberate effort to minimize the risks associated with potent opioids like OxyContin. According to drug safety expert Dr. David Yerlink, the message that physicians should use these drugs more liberally was one they were happy to hear because of the limited treatment options available for chronic pain. Canada now ranks as the world's second biggest consumer of pharmaceutical opioids, second only to the United States. To put that in perspective, 21 million prescriptions for opioids were dispensed in 2017. That's enough to stock every medicine cabinet in the country. In addition to the widespread dependency that was fostered by overprescribing opioids, the escalating death toll that we are currently witnessing is largely attributable to the fact that the illicit or street drug supply in Canada has become toxic, overwhelmingly laced with poison and tainted with fentanyl. A recent study by the BC Centre on Substance Use found that just 39% of drugs tested at 2 supervised consumption sites contained what the buyer thought they had been sold. And there has been a devastating impact on first responders across our nation. Now, Mr. Chair, given the scale and depth of this crisis, it's easy to succumb to despair, and it's tempting to claim that there's nothing more that government can do. And while there is no immediate or complete fix to this overdose epidemic, that doesn't mean we've exhausted all options for action. Indeed, there is much more that can and must be done. Canada's New Democrats have a number of positive, evidence-based proposals to bring this crisis under control. First, Madam Chair, we must recognize that this crisis requires an emergency declaration at the national level. British Columbia, the epicenter of the opioid crisis, has been in a declared state of health emergency since April 2016. Canada's New Democrats have been calling for a similar declaration at the federal level for over 2 years. Unfortunately, the federal Liberal government has refused using this tool. They claim that declaring a public health emergency is unnecessary, saying it would provide no additional levers for action. This is absolutely false. Such a declaration would constitute a formal recognition that we have reached an emergency situation in this country when we're burying 11 Canadians a day. And it would affirm to the public the urgency with which the federal government is approaching this crisis. In addition to its symbolic value, however, a declaration of a public health emergency would have the practical effect of empowering the federal government to coordinate a pan-Canadian response to this crisis, something it has not done to date. Specifically, Section 8(1) of the Emergencies Act grants the federal government clear authority to make orders or regulations that it believes are necessary for dealing with an emergency. This includes the authorization of or direction to any person to render essential services, the regulation of the distribution and availability of essential goods, services, and resources, the authorization and making of emergency payments, and the establishment of emergency shelters and hospitals. This means we could cut red tape and allow the federal government to rapidly authorize and support overdose prevention services currently operating illegally and with no federal funding, but saving lives. This means that health professionals currently working at unsanctioned sites throughout Canada would no longer be forced to put their licenses and personal liberty on the line to save lives. and it would allow for the emergency allocation of resources on the scale needed to adequately address the mounting death toll. Second, Madam Chair, we must begin to treat substance use and addiction for what they are, health issues. Therefore, we need substantial, new, federal money for evidence-based addiction treatment across all modalities, from abstinence to 12-step to opioid substitution, tailored for every demographic, from youth to women to Indigenous Canadians. And treatment must be available as a fully insured service provided by our public health care system so that individuals and families can get timely access at quality facilities regardless of income or ability to pay. When someone is ready to get treatment, they must get it immediately. They can't wait even a day or they're risking a death sentence. Yet, on this score, our public system fails utterly. For example, the waitlist for publicly funded beds at the Pine River Institute, Ontario's only residential treatment program for kids aged 13 to 19 years old, is a year and a half. Oh. Angie Hamilton, Executive Director of Families for Addiction Recovery, has rightly called this situation unconscionable. It's time to recognize that substance use disorder is a disease like any other. It's past time we close the fatal gap in our healthcare system that fails to deliver the treatment that Canadians need. Third, Madam Chair, in the U.S., federal authorities have secured criminal pleas and over $600 million in fines, damages, and other costs from Purdue Pharma for misbranding OxyContin with the intent to defraud and mislead. This summer, the NDP government of British Columbia also filed a civil lawsuit against opioid manufacturers and distributors to recoup the enormous public costs of addressing this crisis. That lawsuit is open to every province and territory and the federal government to join. Madam Chair, if corporate executives minimized or concealed the addictive qualities of prescription opioids in the U.S., it's very possible that they did so in Canada as well. It's time, the New Democrats say, for the federal government to support BC's lawsuit and launch an investigation itself to determine if criminal sanctions are warranted under federal law. Fourth, Madam Chair, we must be willing to look past the discredited war on drugs ideology in favour of an evidence-based approach to drug policy in Canada. Given that overdose mortality rates are overwhelmingly being driven by the tainted illicit drug supply, what every police officer in the country will tell you, it's clearly necessary to explore the decriminalization and medical regulation of substance use. Indeed, it's obvious that we could avoid thousands of unnecessary deaths if, instead of consuming poison, substance users had consistent access to regulated chemicals in a known dosage through our healthcare system. The example of Portugal shows that decriminalization works. In 1999, there was a drug crisis in Portugal related to a cheap, toxic heroin supply. Faced with rising harms, the government of Portugal decided to treat substance use as a public health issue, not a criminal one. The crisis in Portugal soon stabilized, and the ensuing years saw dramatic drops in problematic drug use, HIV and hepatitis infection rates, overdose deaths, drug-related crime, and incarceration rates. 90% of public money spent fighting drugs in Portugal is now channeled towards health care goals, just 10% on enforcement. In contrast, in Canada, 70% of funding spent combating drug use is spent on enforcement. In Portugal, 6 people per million die from drug overdoses. In Canada, the number is 110. It's time Canada explored this approach. Finally, Madam Chair, I wish to conclude my remarks by speaking directly to every Canadian who's lost a loved one. Your courage to show up, to speak up, to share your experiences, to demand more in the knowledge that we can do better is inspiring. It is in the service of the greatest legacy we can pay to those we have lost, to do everything in our power to prevent the avoidable, unnecessary death of another loved one to addiction. We can put an end to the marginalization and stigmatization of our country's most vulnerable citizens. We can turn the tide on this crisis, and we can forge a better future based on courage, compassion, love, and science. It's time we did so, and the New Democrats are working hard towards those goals.
Questions and comments? The Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Madam Speaker. And I did